Welcome, everyone. We're going to get started in a minute or two. I just want to give a few more minutes for folks to finish joining up. Thanks for joining this afternoon. Give folks like one more minute to finish joining. All right. I think it's two after. We can go ahead and get started. Welcome. Thanks for joining this crisp in context and clinical application training webinar. My name is Kevin Phillip. I work as part of the user communication team. Um, and we put on events like this weekly. So feel free to join our website on our events page. You can see all of the upcoming webinars that we have and the various topics that we do. This session today is specifically aimed at talking about our clinical application here at CRISP. We refer to it as In Context or the Clinical Information Service. Whether you're new or looking to get a refresher of this tool, hopefully you'll walk away with a strong foundation in how you can use this tool in your daily workflow, and how to navigate all of the tabs that we have. Before I jump into the main materials for the session, I did want to talk about some housekeeping items. So first, we are recording this session. We'll share the slides and the recording with folks afterwards, as well as publish them to our website and YouTube channel. We do encourage questions. My colleague Cindy is on the line to help answer some of those questions in the Q&A feature if you want to type those out at any time. We also have some dedicated time at the end to answer your questions. Um, I have a few slides prepared and then I'm going to jump into a demo. So I expect maybe 30 to 40 minutes in terms of materials. And then we can open it up to questions. Um, yeah, I think that's enough to get started. So the first thing I kind of wanted to talk about in terms of background is just all of the various data sources that as CRISP we receive to aggregate as part of a patient record on CRISP. So we work with hospitals and health systems to receive their ADTs and CCDs, as well as radiology images, discharge summaries. Um, we work with payers and state agency to receive claims and other public health information, Quest and LabCorp. Um, we work with them to receive labs for organizations if they permit us to. And then from our CRISP participants, we do receive data, including, their patient roster, any care notes or care alerts that they submit, any social determinants of health screenings, things of that nature. We take all this data in and we store it in our systems. And then are able to use it downstream in tools like InContext and the Clinical Information Service to allow you a portal or a view into viewing all of this data for one patient that we have from these various sources. So at a core of what we do here, this is kind of what HIA is intended to do, and CRISP does, and especially does through this tool. Um, when it comes to in context, there's two ways you can access it. One would be through a direct integration in your electronic medical record. Some of you have this set up, and some of you only use the web-based portal portion. But the benefit of having it integrated directly in your EHR is you don't actually have to log in separately outside of that. However, this limits to you to the patients that you are treating and who already are in your EHR to look up. Um, the CRISP portal, on the other hand, is the web-based platform that you can use to access other tools um, outside of the clinical information system or in context. But you can also search for patients outside of your panel or your treatment relationship. So this is a good tool to use, especially if you need to search beyond just the patients you see regularly, and you don't. And you can also use other CRISP tools there as well. So those are the two ways you can access this tool. And I just want to talk about that. The demo today, we'll walk through the portal portion. However, this application um, works the same and shows the same data in the EHR version. So this is what the InContext tool looks like, and the function is to embed real-time cross-organizational clinical data directly into an EHR workflow or through our CRISP portal, giving providers seamless access to the information they need to coordinate care and improve health outcomes. Um, to give you a sense of the tabs that we'll walk through in the demo, here is how the in-context tool is broken up. It's primarily broken up by data type, as well as sometimes data source. Um, but we are more working to parse data as to be present in a specific tab about a specific piece of data that you might be looking at, for example, allergies or immunizations. And in the demo, we'll walk through all of those things in more detail. But I just want to give you a sense of what offerings we do have there available in the tool. Why would you use in context? Um, there's a couple examples here. There's definitely more that we could think of. But for example, I'm a physician and I need a prescribed controlled substance, and therefore I need to check the full medication history of my patient to prevent over medication. As a emergency room nurse, when a new patient arrives with no medical history, I want to access the patient's medical history that exists outside of my EHR. As a practitioner, I'm viewing a patient's chart and need to review additional information in concerning an encounter. So these are a few reasons that you might be using this tool, but there are many others as well. So now I'm going to jump over to our demo portion of the training. So give me 1 second as I switch my screen so I can pull up the portal. Okay, now we are in the portal, and this is, like I mentioned, a way you can view the in-context tool. Obviously, the other one is through your individual EHR, and I think each setup might look slightly different, but once we get into the tool, the data and the tabs there will work the same in both versions. Um, so the first thing you would do when you come to the portal to launch the in-context tool is actually perform a patient search. I actually already did with our test patient here, Gilbert Grape. Once you hit patient search, you get search results here. You can click on the patient record, and then you want to launch this application called clinical information. So you hit the window here. Alternatively, you can also hit the box here at the bottom. Both will take you to the same spot. And then it launches here in the iframe, and you can see it's labeled CRISP HIE in context here at the top. So this view, for whatever reason, if we have match patient records. In our master patient index, you might see a list that allows you to kind of look at the various patient records. And this icon here can help you give some more information about um, using which one you want to select to submit. So I'm just going to click that first one there, and then we're launched into the InContext tool. Um, so on the side, you have other crisp applications. We can hide that for now, but if you wanted to navigate to another crisp tool, you would be totally leaving this in context piece here, but you can always slide that to minimize it. But then you want to open this menu here, and this allows you to click through all of the various in context tabs that we have. Um, by default, users will be brought to this medication management tab, and then PDMP data will load if you have access to PDMP. If you don't, PDMP, for those who don't know, it stands for Prescription Drug Monitoring Program. It will just say you don't have access to this or something like that. I forget the exact error message that pops up, but essentially that's what appears. You can change that at any time, and by that I mean the order in which the tabs appear and the order that your landing page is. So you can go to this user settings button here, and then you can move the tabs up and down, and whatever one's in this top position is going to be the tab that you land on when you log into the application. So something to keep in mind that you have the ability to change. Um, Before I get into the specific tabs, I do want to talk about our top toolbar here. So you'll see the patient demographics no matter where we go, or kind of pinned these name, gender, and date of birth is pinned at the very top. And then you do have some buttons here on the side. So these three dots give you the ability to send us feedback in a kind of support form. Um, this glossary will give you a few definitions as well as some background on some of the pieces of data in each tab. So if you're ever curious about what's listed there, you can come to the glossary section to view that information. And then this about button will just tell you the version number that's running. Um, the only reason you'd care about this version number is um, update the tool regularly, obviously, with new features. And we sometimes send release notes. So if you ever want to double check what version has been released, that's how you could do it in the About section. These priority alerts here um, are really meant to flag important health events that the provider should know about. Things like overdue overdoses, past overdoses, or certain infectious diseases. The system automatically creates these alerts when the patient record includes something like overdose or other things that are based off of ICD-10 codes. Um, and you can find these at this top toolbar. And any time that there are alerts there, this icon will update with the number of priority alerts that are there. You can also see the type, description, and source within the section here. With all of the tables that are presented in context, you will find very similar tools at the very top. If you are able to download these to PDF, this download symbol will appear. This disclaimer button might give you some more information about specifically things within the table. But then you have the ability to search. Search works really well in this tool where you can search for um, a string of characters, and it will kind of search the whole table without you actually having to specify what field you want to search it in. Um, so maybe I'll type in, and you can see in real time it's kind of updating itself. It works pretty neat. Um, but I can even be more specific. If I put 30, then it would narrow it down to any place that it says 30 in the table. So search function works really well. View columns, you do have the ability to hide and add columns sometimes within each table. So that is another function, or you can filter. So um, this is a very complex filter, but it allows you to basically use the information in the table to select certain things that you want to see. This date fields and then all of these other fields kind of preload with what's available to filter within the table. I point this out. All of these tables have similar functionality. So as you navigate through the tool, you'll be able to use these not just in the medication section, but any other section as well. All right, so I'm going to actually move up a tab to patient information, and then I will go down the list here to talk about what's presented in each of them. So demographic or patient information is where you'll find demographics and then also next of kin information if available. Um, the demographics field will present any kind of demographic information as well as any contact numbers that we do have for the patient here. And then next of kin, if we do have that on file, will display on the right side of the screen. Okay, so then moving down, medication management. So this is where we pull medication data from multiple sources, things like PDMP, CCD, and then pharmacy data. The first tab will display the PDMP, and again, if you don't have access to it, it will display an error saying that you don't have access to it. PDMP tracks the prescribing and dispensing of controlled substances across the state to help reduce misuse and diversion while helping to preserve appropriate access. On the top bar here, you see what's called the advisory areas, and this gives you four key metrics that summarize the patient's prescription activity over the last 90 days. That's why you're seeing data presented here, but because of the date fill, that's why they're all zero. Again, this is a test patient, so sometimes things are like that. Anyways, these are meant to help providers quickly spot when a patient might be at high risk for things like overdose or safety concerns. Um, and the definition for these are available in this definition slider, so you can see exactly what all of these advisories mean. Um, and then dispense medications. Um, This is different than the PDMP. We work with dispensers in the state to receive all dispensed medication, and we present it in this tab once received. Reported medications. These are things that are sourced through CCDs, but it's important to note this section might not always reflect a patient's complete medical history, but it will give a valuable overview that can complement something that you might have already internally or might be presented in the dispense medication section. The system also uses a deduplication algorithm to make sure the medication list is easier to read. So instead of seeing the same drug listed multiple times from different sources, you'll get it rolled up into one, so it's more digestible to allow you to drill through the details if you need to. Um, Here is an example of what reported medications look like. These icons on the side tell you if dose has changed over time for something. All right. I'm going to continue on to clinical data, and this is where the bulk of the information can be found on a patient record. Um, so, um, Starting with health records, there are three different sources of information that are presented as in health records. There's lab data, there's radiology data, and then there's clinical notes. The All tab shows all of these sources in one view, but you can then click into the various subtabs labeled as such to only look at labs, for example, radiology or clinical notes. Um, One thing I do want to point out with health records and other sections of the clinical data tab is there's this button here that can help you hide information from your own organization. We found from many users that they, already have access to the data that they reported to CRISP and don't need to see that. They're really just looking at in context for outside information that they might not have on file. So using this button, you can hide or show data from your organization to display in the table. And that way you're only getting the relevant information that is important to you. I do want to talk about lab data real quickly. We added a new feature recently that allows you to view labs in a timeline view outside of just this single table. And what you can do with the timeline is select the time period that you want to look at labs for up to the last 5 years. And what it will do is it will display the labs in a chronological order so that you can see over time how lab panels have changed. I wish this test patient had better data for you to see it change over time, but you could imagine, let's say, if hematology was performed multiple times over the last 5 years for this patient, you could see how data ranges have changed. Um, and we present it in a way that you can quickly navigate that rather than seeing it in a list view where you're only stuck with the viewing them one at a time. Within the labs themselves, you can click down to see more information about them. Um, and you can also download them to PDF if you choose to from this window. Radiology images, you can click to view images by clicking that icon if they're available. This eHealth viewer does take some time, so I recommend folks, if they are uh, going to look at an image, maybe load that in the background and then come back to it. Um, but you can also view any notes that are related to the image by clicking on the record here. In the slide deck later, I do have a visual of what this looks like. Sometimes this test patient might not work, but I'll show you exactly what the images kind of look like that way. And then clinical notes, similar to the other ones, you can click to view the report, and then you can download into um, a PDF view if you need to. Some of them will have a report that looks like this from the actual source. You can click that button to view that. So I'll just show you that again. So if it says something like this is where the view report icon is. Moving on now to structured documents. This is where you'll find um, more structured CCDs or clinical documentation from various sources, including national networks. So this all tab is pulling in all of the data that we have within CRISP, but then also can receive out of state through national networks. And this icon here will tell you how many pieces of reports we have from the various sources. Again, you can hide your own organization's reports if needed. But reports are very similar in terms of if you click down into them, they have a table of contents that allow you to navigate to specific sections of the report. But you always do have the option to download them to PDF. And then all of them will have this kind of summary here at the top that tells you basic information about who conducted the report, um, and the demographics of the patient as well. So I'll just pull up another one so you can see that. Table of contents, depending on what's in the report, they may have more or less sections for you to view. I'm going to come back to encounters, but one thing that we did find with users' feedback on using these structured documents is they are really great, but sometimes hard to view when you are looking at a patient and you kind of want to know specific pieces of information pulled from these documents. Um, so these later tabs, starting from problems, are pieces of information that we've actually um, parsed from those structured documents. So problems, for example, they relate back to problem codes within the CCD documents, and you can think of them as kind of descriptions of underlying or overarching complication that a patient is having. For example, here you see type 2 diabetes, type 1 diabetes, and some various other category of a condition that we can report there. Immunizations. Most of these are actually coming directly from Immunet themselves rather than CCDs, but they could if they were presented there as well. Allergies, again, parsed from CCDs and vitals and procedures. I'm not sure this test patient has them. I do have screenshots of these two tabs within the slide deck that I can show once we go back there. Um, we are working on parsing more pieces of data, but if you have any suggestions, that would be awesome for our team to work on. But we know that sometimes these are hard to see, and so seeing the data presented individually outside of that is super helpful. The last tab to cover in the clinical data is just encounters. And this, similar to health records and structured documents, you're seeing all encounters presented first, but then you can navigate to hospital and outpatient. And again, you have the ability to hide your own organization's data. Um, yeah, I think that's everything I wanted to cover in clinical data. Um, let's move on now to care coordination. Care coordination, you'll see four sub-tabs: care team, care alerts, referral history, and advanced directives. Um, the care team, this is data either from the CRISP patient record or from CRISP participants that we've received. Essentially, then we can provide the role of those individuals, but this is intended for you to be able to see more information about who else is seeing the patient. We also present in this icon, if available, the provider's contact information for you to do things like care coordination or follow-up. Care alerts, these are coming directly from CRISP participants, and they're intended to be kind of short snippets of vital pieces of information that you should know that are generalizable to the patient um, to help inform some of your care decisions. Referral history, CRISP has its own referral tool that allows providers to refer a patient to various care programs that various CBOs work with CRISP to receive referrals through this tool for. And any of those can be tracked here. You also see the status section, so you can see if they've been enrolled, accepted, if they're still pending or rejected for any referrals that have been made by you or other folks for this patient. Advanced directives, if available, advanced directives will appear in this tab, and you can view the document by hitting the open document form. I don't know if this is working for test patients. I'm going to try one more. Yeah, so this is what it would look like. So you could pull it up separately here. But any advanced directives that we do have for the patient will be here, and we're working hard with the state to kind of um, get more and more advanced directives populated here, so it'd be more helpful for all providers. Social needs data, there's two tabs. There's assessments and conditions, similar to the referral tool that pay providers have access to. You also have access to a social needs assessment screener that um, asks specific questions about areas of social determinants of health for patients. And then when we receive those, we add them to this assessments tab for the patient. Anything that's needs um, support or that is flagged as um, needing assistance with this particular area will be flagged with a red flag. And then you can come in here and see what questions created the flag or what questions were received through the screener. And so you can see the various categories that we ask these questions about. And then conditions, any Z codes that are pulled from um, encounters, CCDs, or claims that we have will be presented here, and this will just tell you a description of what that Z code is saying for the patient. Data from claims. In Maryland, we receive data from all hospital sources for claims and Medicare and Medicaid. And then we parse the specific pieces of data from claims into these sub-tabs. So we have medications, diagnosis, procedures, and encounters. Um, and then those pieces of data will present um, in these various tabs. All right. The last section I did want to talk about, this is a new feature that we just added to InContext maybe a year and a half ago, or maybe a half year ago. Um, but as I just demonstrated, there's a lot of tabs to click through. And as a busy clinician, um, you might just know what data you want, but you can't find it by clicking through every single time. So what my patient summary allows you to do is to centralize all of the key pieces of information that you want to see every time you view a patient in CRISP in one single dashboard. So I'm going to walk through how this works. You may have noticed as I was clicking through that all of these tabs have a pin icon next to them, and that pins them essentially to the dashboard that we call My Patient Summary. So, for example, if I always want to know the patient's immunizations, if I always want to know their PDMP medications, their dispensed medications and reported medications, I can pin those. Let's say I want to know the patient's care team, and then if they have any social needs conditions that I should be aware of. By pinning all of those, coming to my patient summary, I can see all of these pieces of information in one time, and I got logged out. Hold on, I will log back in. Sorry. Um, Go back to clinical information, and we were talking my patient summary. Okay. So by hitting this pin icon in any of these tabs, it puts it in a single dashboard for me to view. I can move these pieces of information around so that the most relevant is at the top. Um, but now every time I search a patient, I can come to my patient summary and view that information without having to do all the clicks that I did to get into all of these tabs. Um, One other thing that you can do to even further reduce the clicks that you have to make is you can actually make my patient summary your default view by if you change the tab order in the user settings. And now you can see because it's at the top, my patient summary is at the very top of the tab. And I will quickly show you how that works. Going back to the home screen, clinical information. And now I'm directly in my patient summary and I'm seeing the exact data that I want to see and without having to navigate through the whole system. Um, so just something that we've added to make your life easier and make it more customizable with the data available in CRISP. Obviously, you still have the option um, to navigate to those tabs, and you can always change what is presented in your My Patient Summary at any time by clicking that pin icon and in the My Patient Summary, unpinning it by clicking again, and you can move them around. But the last pieces of data that you pin there will always be what is presented when you come back. So that's a cool new feature that we added. Apps. This section allows you to jump from what you're currently viewing into another section. This DC My Directives is for DC participants, so we can ignore that. But the screening tool is what I talked about in terms of the social need assessment questionnaire. So through the function, you can just directly jump to the screener without having to go through the home page and clicking the icon for that. All right, I think that's everything I wanted to cover in the demo. I'm going to stop share and then I'm going to share my slide deck once again. Um, like I mentioned in the presentation, I do have a few other screenshots to show folks. So this is what a radiology image would look like once you get it to load. And there's actually some features within the viewer that allow you to manipulate and um, view these images in detail. And then here are some of the sections that might not have had data. I think the problems and allergies did for the test patients, but the vitals and the procedures didn't. So you can see in this screen grab what those sections look like that is parsed from the CCDs. I included this screenshot as well. We were able to see it, but I just wanted to make sure I touched on it in case it didn't view for the test patient, but we added this timeline view in the labs function for you to see labs changing over time. One other piece of data that was just added recently to the all of the data that we collected, CRISP, is data from Exact Sciences. You might not be familiar with that name, but you might be familiar with Cologuard. And Exact Sciences is the organization that owns and operates Cologuard. And we have worked with them to start receiving their Cologuard, Cologuard Plus, um, on-card guard, liver test, and wrist guard test assessments, and are now presenting those in the structured document section. And if you see a source from Exact Science Laboratory, that is what that piece of information is. So just something to be aware of. We are working to gather more information to make your um, care of patients better. And this is one of the ways that we're doing that. Perfect. So about 40 minutes passed. I got through all the material that I wanted to cover. I'm sure I'm sure folks have questions. And if you do, please use the Q&A feature or raise your hand. I'm happy to take you off mute, for you to ask your question. If you don't have any other questions at this time, you could also reach out to us at our support line that's listed on the screen, or go to our website to view any additional webinars or training materials that we do have on InContext or other CRISP tools. Someone asked, will Cologuard be held under labs? So currently it's going to be held under CCDs. I'm sure on the backlog is our team's ability to maybe parse that. But um, I'm not sure if it will ever be presented in labs, to be honest, just because of the data source. But it's something that we can consider. But for right now, it will be found in the structured document section. And you can maybe filter for exact sciences or search for exact sciences. And if the patient has taken one of these um, things.
Kevin, this is Cindy. Our preventative services in Population Explorer uses that data, right?
I'm not sure.
Yeah, I think it does.
Okay.
But we'll double check and can follow up with the
Yeah, I
group
just
on
don't
that.
know
Yep.
if we're using this or just traditional colonoscopies to filter.
Mm-hmm. Okay.
Yeah.
Okay. It would be great if we did, right?
Yeah, I mean, I
We'll
think
check on that.
I don't know enough, obviously, because I'm not a
Yeah,
specialist in this field, but
we can
oh,
follow up. Yeah.
yeah.
Thank you.
Mhm. Why do so few of my patients have any data available, even when they tell me that they have had labs, hospital stays, etc.? That's a great question. It's going to vary per patient. However, patients do have the ability to opt out of having their data shown in CRISP. So it's possible that this patient is opted out of CRISP, and that might be why they're not seeing data. Other reasons are we're not connected currently to the labs or the hospitals that they have seek care at. Highly unlikely that we wouldn't be connected to the hospital, but labs is definitely a gap in some of the data that we do have on every single patient. Um, It could be that treatment that they received at uh, these places qualify under 42 CFR, and they haven't consented to share that sensitive data with the rest of individuals who are searching for them in CRISP. So there are a few different reasons, and it's kind of a case-by-case basis on why data might not be available. If you're seeing multiple patients, it's probably a gap in our coverage in terms of who's connected with Chris. But happy to have a conversation with you offline if you want to reach out to me, and maybe we can look at a few examples, and I can give you a uh, more specific answer to your question once I look at the details. But on top of mind, those are a few reasons why we might be missing data for patients.
Yeah, the only thing I would add to that is that when we onboard a new ambulatory site, for example, we give them an opportunity to say if they use LabCorp or Quest, they can sign a one-page agreement that says, when I place labs, when I order labs, please share the results with CRESP. And so we start receiving all of their data. So it could be that where your patients are going, that has not been done. And it would be helpful to, like Kevin said, you could reach out to him or you could reach out to your account manager from CRISP, and we could just do some research for you. Especially if it's a lot of your patients that don't have the data, we could at least answer for you who is sharing lab data, who is not, based on what you give us. So thank you.
A great question. Can discharge summaries be filtered? Great question. Let me see. So I know in encounters, for example, you can filter on diagnosis and discharge disposition. Um, I'm not sure you can filter in that way across the structured documents. I don't know, Cindy, if you have any other suggestions
Are
to
you
that.
still in the system?
Yeah, I can pull it up.
So yeah, just go into structured documents. I'm just trying to remember if they have a search capability. So you're looking, Christy, for some particular wording within across discharge summaries, or you're just looking to view all discharge summaries? You might have to take her off mute, Christy Smith.
Yeah, let's see. I think I allowed you to speak now, Christy.
I didn't ask the question about the discharge summaries.
Oh,
Oh, sorry.
anonymous,
It's
sorry.
anonymous. I saw your name underneath it. Sorry about that.
Right.
Um, so yeah, can we search across documents, Kevin, I think is the question.
Yeah, I am.
Like, can I see all my discharge summaries? Like that search button up there
Yeah, I think it just searches it in the table,
on the source or on
like this data.
the title within the table and that kind of thing. So
Yeah.
if our title is,
Yeah, I'm not sure you can search across like all of these individual.
yeah, whoever asked that question, if they want to add more into what they're looking for, and we can take it back and see if there's
Yeah,
something we can do.
thanks. All right, now to Christie's question. Is there a time frame that your patient summary will automatically remove if you haven't logged in to view it? I don't think there is, Cindy. I don't know.
When you say patient summary, what are you referring to?
If
So what?
I
Yes, go ahead.
if I was like putting together a patient summary and then I logged out and logged back in for a week, is it just gonna after a week, is that what's gonna populate?
A document, Christy. So when you say you're putting together a patient summary, we don't get rid of any data. So if we receive data either from your EHR or through a document that you've sent to us, it stays out there.
Okay.
Okay. Does that help?
Yeah.
Okay. There may be a nuance. Are you talking about putting it together in your EHR and then it comes across to us?
If I was like viewing a certain patient and then I put together my own little like what I wanted to see on the patient summary and then
Oh, the My Patient Summary tab. Okay,
yeah,
go ahead. Go ahead.
Oh, yeah.
Yeah,
and
go
then I
ahead.
log out and a week later log back in, is that still going to be this like,
Yes.
there?
It
Okay.
stays whatever you put, whatever you pin to My Patient Summary, whatever sections you pin, always stay there for you. So you can select any patient and you'll see My Patient Summary on them, um, just like that. Yeah, it doesn't change unless you change it.
Okay.
Yeah.
It's what we call sticky. So whatever you've last done with the summary in terms of pinning or unpinning things is what you'll see the next time you log in. And it saves automatically without you actually having to click save, which is cool. So sorry, I misunderstood your question as a summary for a patient, not the feature My Patient Summary. Sorry about that. Okay. Um, Are you going to share the training link? Yeah, we will share the recording as well as the slide deck to this afterwards. Um, and just noting on time, we have 10 minutes left. There's lots of questions, which is awesome. If we can't get to your question, we will definitely follow up with you afterwards, but we'll try to get through all of these. What is the frequency in which the portal is updated? How long does it take for a prescribed medication to be reflect back in the PDMP? Great question. So, um, the data populated in certain tabs here is virtually real time. The PDMP data, I don't know offhand how long that takes to get from submission to presenting in the tool, but I'm happy to follow up with the PDMP lead on our team to give you that answer. It also depends on source of the data. So claims, for example, would not be something that's updated in real time, something that's presented on a month or two delay just based off of how we receive claims. But other things that are populated from ADTs, for example, might be more real time. I don't know, Cindy, if there's anything else you want to add to that answer.
Yeah, they're almost real time for the most part. So if you see anything other than that, Moses, any particular example that you want to give us at some time, just let us know. Just send it in through support and your account manager will get back with you.
And I'm happy to reach out on the PDMP to give you a more approximate time on that one. Is it mandatory for hospitals to upload their clinical data to CRISP? Um,
In Maryland, all the hospitals send us their
y-
data.
yes. I think the word I got stuck up on is mandatory. I'm not, it's been
Uh-huh.
such a
Yeah,
long
it's a
time since
state.
then.
Yeah, it was
Yeah.
required. Yep.
The PDMP tab, when I use it, displays no PDMP data available from selected state. I believe that is it could be two things. Either that is saying you don't have access to view PDMP data, or there's no PDMP data for that particular patient that you're looking at. My thought process, if you see this multiple times, it's probably because you don't have access to the PDMP. But you should reach out to support if you think that you should and you aren't seeing it. How can we start to build a census within CRISP? I'm not sure I understand this question. If you want to maybe unmute you if you want to clarify what you mean here.
Yes, so in DC, they were able to create a patient census of the organization I used to work for within CRISP, so that when I went into CRISP, all I saw was my patient data, unless I also wanted to search for someone else. So I was just wondering, is there a way to do that here in Maryland?
Yeah, Nana, are you talking about the CRISP reporting services capabilities?
I'm not quite sure if that's the
Okay.
same or a different name.
Yeah, because when you come into the portal, you're going to search for a patient. Okay.
Correct.
It's not going to limit you based on what's in your EHR. It's kind of statewide. That's the difference between using one of the differences between using CRISP InContext in your EHR and using CRISP portal. Okay. In the portal, it's going to look statewide. It's not going to limit you to what's in your system or on your panels. Okay. So that's one difference. But when I hear you asking about a list of patients or a set of your patients, we know which patients are yours based on panels that you submit to us, right? So, do you know who your account manager is?
Not off the top of my head right now. No.
Who are you with?
Pace of West Baltimore?
Pace, Pace.
Correct.
Okay, Pace of West Baltimore. Let me look up your, um, and get back to you. Throw your email in there for me, and I'll look that up, and we'll loop back with you and work on that with you because it sounds to me like you're talking about a panel of patients that we know are attributed to you, and then using them most likely in either Population Explorer, which is our encounter notifications, or our reporting system, which lets you study populations and do all kinds of things like that. Does that make sense?
That sounds about correct. I think it's
Okay.
population score, actually.
Yeah. Okay. That would be a panel. And we can help you get set up with a panel as well. So yeah,
Thank you.
just sure thing. Okay, Kevin, back to
Thanks, Cindy. Appreciate you thinking through that question. Okay, so it looks like Carla was the one who asked about summaries earlier. Looking at patient encounters, I access CRISP to pull and review patient discharge summaries in CRISP. Once I open the patient files their way, is a feature that allows me to filter for just discharge summaries only. Um, I still don't think there's a way that you could just quickly filter for just that.
I think right now the filters work off of the titles, and I think sometimes
Yeah.
discharge summaries are called summarization of episodes. So let us get back to you on that. That's an important question too. Like, is there a generic name used for more than discharge summaries on discharge summaries? That's what I'm wondering,
Yeah.
right? So Carla, it's going to be that in the when you look at this structured documents page, there are when we do a search, it's only going to look at that title um, or the type. Okay, the title of the document or the type. So I don't know in general, are discharge summaries called something and only that, and they're the only things with that unique name. So let us loop back with you on that. We'll loop back with the whole group. We'll send it out to everybody that attended. Okay.
Okay. Why is methadone not included in CRISP portal? So I believe this is 42 CFR type question, right, Cindy?
Yeah, I think there are legal implications of that, Moses, but we can get a better answer for you. But that's yeah, that is if an account or a department is a 42 CFR Part 2, substance department, and they've called themselves out as 42 CFR Part 2, that data is not shared unless the patient opts in. It's kind of the opposite of in Maryland, you're opted in automatically for all your other data, but for 42 or 42 CFR Part 2, you're actually opted out until you consent and have a consent on file at CRISP. But for methadone in general, I want to check a little bit more on that regarding like, is that just a statewide thing where we're not allowed to show it and we need consent, or is there more to it? So hopefully that answers your question right now. But I know that's a gap, right? That's that's a gap for you. But we'll include that in our follow-up, additional information in our follow-up.
If a patient picks up controlled medication from out of state, am I able to track that in PDMP? Oh, let me go to PDMP. Um, I thought that there was a way to configure out of state here, but maybe I'm missing it, Cindy.
I think it depends on the state and it depends which state you're in. So we'll follow up with that too on the specifics. We're learning a lot of things that we need to know better. Um,
Yeah, I
but
thought
yeah,
that
it's
there was a
Maryland
toggle for
PDMP, right?
something.
It's Maryland PDMP, Kevin.
Right.
Um, but we'll still follow up with you on that. But it is just Maryland. PDMP is for Maryland. Yeah.
All right, Winifred, you had your hand up. I'll let you speak. Winifred, are you there?
I don't see her
Okay.
anymore.
Okay. All right. Looks like we got through all of those questions right on time, but we do have some follow-up homework, so we will work on providing some answers to the Q&A for the group. But we do appreciate all your questions and attending this training. And if you have any other questions, feel free to reach out to us. Thanks and enjoy the rest of your day. Bye all.